Hey, how's it going? Today I'm going to show you how to take care of your hands. Now, I'm a chiropractor, also did massage therapy, and I was taught a simple routine to follow to save yourself from ever developing carpal tunnel or overstrain of your hands or any other type of overuse injury that can occur from that line of work. And that could be from anything from turning wrenches to keyboarding. So first thing we want to do is we want to just move our hands, move our fingers, move our hands. So you can open and close. You can open and close one finger at a time. You can do a wave action where you're fluidly moving your fingers. Now, none of this should be strenuous. None of this should be difficult. It should be nice and loose, okay? So waving the fingers, wiggling the fingers, however you want to think about that. Open and closing the hand. You can give it a good little squeeze and then release and extend and get a full extension out of that. Stretch it out a little bit, squeeze, stretch, open and close, wiggle. One finger at a time to the pad. We can close just the hand, using just the hand muscles here without getting the fingers curled. Just using the hand here, like you're waving, bye-bye, a half wave. And then we can curl the fingers all the way down and in, open. Curl them in so you're trying to touch the tip of your finger to the pad of the hand. Okay, do that a few times. You get the thumb involved as well. Then you could do that and then make a fist. And then open. Okay, so once we've done that, I like to shake it out. Anytime I feel like my hands are getting a little fatigued from doing anything, shake it out. Always a good go-to. Give it a little shake. If it hurts, shake more gently. And then as you feel comfortable, you can get a little more aggressive with your shake. And it should feel good. Everything should be pain-free. So next, we do some wrist rolls. Now we could do this in all directions. We could do figure 8 type motion. You could roll inward, pointing the knuckles in, then rolling them out from the top. So one hand's going clockwise, the other's going counterclockwise, and the opposite, rolling them outwards. Right? And I'm doing it with a loose fist. I'm not squeezing tight, I'm loose. And then you could do it with an open hand. Now I like to get the elbow involved with that as well, where I will extend the elbow, bend, roll the wrist, extend, and straighten them out. And you could do that outward, side to side. You could do that straight in front of you. There's no perfect way. Whatever feels good for you. Roll them in and out. Okay, so we got the hand open and close, one finger at a time. We got the pads of the fingers, the tips of the fingers to the pads of the hand. We got a fist, spreading the fingers. And then we got some stretching to do. So we mobilized it, we got the blood flowing in there, we got it activated. Now we're gonna stretch it. So I like to start with the fingers. We go one finger at a time. Now if your wrist is straight, okay, it's gonna be different than if your wrist is bent back. So you can play with that, having your wrist bent, pulling your fingers back, or having your wrist straight as you pull your finger back. And feel the difference, and whatever feels better for you. And you could go straight wrist and then roll it into a bent wrist. Whew. And feel that strength. So I like to think colors. Yellow being no, white being nothing, you're not moving at all. Yellow, you feel a little bit orange, it's starting to get a little uncomfortable. Red, it hurts. So I like to stay in the yellow to orange region when you stretch. You don't ever want to make it hurt. If it hurts when you first go into it, you're starting to stretch and you can't go very far and you instantly have pain, you may need to rub it out. You may need to grab the muscles and start massaging them, push them around, rotate your joints a little bit, twist them, grab them, squeeze them, give them some stimulus to get some blood flow in there, because you most likely have some form of stagnation, some arthritis, or some tendonitis. And if it's really bad, obviously consult a physician and or try ice or heat therapy to get some stimulation in there. So we got stretching the fingers one at a time, straight wrist and bent wrist, playing around with those different things. Now we also have a bending of the finger and then outward motion, lateral motion. So we're going straight back and then we're bending it to the side, side to side, straight back, side to side, straight back, side to side. And wherever that feels like it needs it the most, hang out there for a little bit. Take some deep breaths. Allow it to settle into that position, into that direction. Oh, that should feel really nice. Do that with the other side here. So straight back, side to side. You don't need to go super far, just go to your limit. Okay, now we have all of the fingers. Take them all together, then just the thumb, taking it back. And the angle I'm going here, you're gonna play with those different angles. I can pull the thumb out. So our thumb does adduction, abduction, flexion, or opponents. It's going opposite towards the pinky, right? We can go here. So there's these different motions that the thumb can do. It can go back this way, it can go back this way, and there's a combination of the two. So I can pull it straight back, I can pull it down away from the web, if you will, pulling it straight down and then back. You want to be careful with that. We can pull it more back, up at an angle, cross this way, right? So towards the knuckle. Think about that thumb, try to cross that thumb over your knuckle. There's a little stretch that occurs right through there as you do that. Then there's just pulling that thumb straight back as far as you can, comfortably, and then there's opening the web and going back. You can do circles with that if you want, gently. Finding your tolerance as far as you can go comfortably. And sometimes I like to take that and even put my thumb on my thigh and then just gently hold that pressure and then roll the wrist forward or backward, gently trying to feel where that needs to stretch the most. So, or I'll just take my pad of my hand palm and push it down against that, trying to touch the thumb to the forearm with the wrist bent back. So there's some different angles you can play around with there. And then lastly, taking that thumb and flexing it forward and pulling it down towards your forearm there. So stretching that thumb out really good. So right along with that, we take the wrist, curl the wrist down, and taking the index finger knuckle and pulling that towards your elbow. So pulling that straight in and then adding a little bit of rotation. And then we could do that with a bent elbow and we could focus just on the wrist here, or we can straighten that elbow and feel that pull all the way through that forearm. So we got that stretch, and then we'll flip it around so our fingers are facing up and we're grabbing the pinky side and we're pulling that in and we're rotating that as well, that way, twisting it and flexing it. Straight arm, bent arm, play with the difference. And then lastly, going back into, you could do a prayer position here, a reverse prayer, trying to keep those palms together and the fingers together as you come down. When you're really tight, your palms will want to pop away from each other. So you want to try to avoid that as best you can, coming down into it. Now, to get that more advanced, I like to take the kneel down or get a chair or a table and plant that wrist down. Now what I'm doing here is I'm going to keep the plumb line from my shoulder in front of my wrist. And then, as I got that planted down, I will slowly work myself back to where my plumb line is now, over my knuckles or over my fingers, depending on how far back you can go. And breathe. Now from a straight on position, if you can see that, you can see my wrist wants to come up as I go back, and that's okay, allowing a little bit of flex into the fingers there. You can play with this. You can bend the elbow a little bit and straighten it out. So we could also do this with our fingers pointing away from each other, just kneeling down and then rocking side to side. And you can do circular motions, just play around with those positions. You could also fold the wrist down and stretch it out just like so. We can go back and forth. We go one forward, one backwards. Kind of play with those different positions. Whatever feels good for you, but the idea is getting full flexion and full extension into that wrist and stretching that out. I also like to do hand sweeps, where I'll do a figure 8 type sweeping motion as far as you can one way, as far as you can the other, and just feel that mobility like you're wiping up the floor. You can stop at any position, take a few breaths, stretch that. Another key exercise or therapy that you can do is grab onto your wrist or anywhere where you feel tension or any type of discomfort. grab onto it with your thumb or your fingers, just give it a little squeeze, and then move it around into flexion, extension, or circles, and feel where that resistance is, and try to stretch through that. So it's called a pin and stretch technique. You're going to pin it down, and you're going to move it through a range of motion. So I'll clamp on with my fingertips, and then roll that wrist down. And if it's tight, you will feel some significant release, or some significant tension in there, and you'll feel that where it's tender. And pain is a good indicator of what's going on. And so if it's super painful, like sharp, stabbing, burning, you don't want to push it too far. If it's just a tight feeling or discomfort, you can work that out pretty good, just pinning that out and rolling that around, moving around, and just playing with different parts of your forearm, grabbing on and moving that wrist around and feeling it move underneath your contact. And then go back to stretching it again, and you should have a little more, you should have an easier time stretching after doing that. Okay, what else can I tell you to do? We wiggle the fingers. Okay, the last thing we could do is put a rubber band around the tips of your fingers and spread them open. And do that about 30 times one hand, switch it over, do it about 30 times the other. And what that does is it strengthens the extensor muscles in your wrist and in your hand that we don't use very often. Often we're grabbing, we're pushing with our fingers, we're holding the phone using our thumbs. Very rarely are we extending the hand, especially with any resistance. And so what that does, that's a great exercise to help balance out the muscles in your wrist. So I hope that helps, and if you have any questions, feel free to shout out.